Why is it important for junior doctors to be aware of a patient's faith or spiritual values?
When patients present to mental health services, they're often in quite significant distress. And so asking about spiritual values or religious faith shows that you want to connect with them at a very personal and deep level, and that you really care about what matters to them. Religious faith can affect the way a person will deal with the difficulties that they're facing, and in the long term can be an important factor in helping them to recover. Religious faith is often protective against mental illness in the first place, but if someone does become unwell, using their religious faith or spiritual values can be an important part of them getting better. The other important issue is that of diagnostic uncertainty. A good example of this is religious delusions. When patients become unwell, they can sometimes present with new religious ideas, which are difficult to assess unless you know what's normal for them in the first place. Sometimes it may be the way that they are coping with their difficulties, but in other cases it can be related to them developing a new psychiatric symptom. And without knowing what's normal for them, it's very difficult to tell the difference.
Why might junior doctors ignore spiritual issues in their patients?
Some junior doctors may not think spirituality is relevant to their clinical assessment, perhaps because they think of mental illness in quite a narrow way. They may often not take the whole person into account, and by ignoring spirituality, they ignore the context in which someone presents with their difficulties. We're often told to think about patients in a biological, psychological and social aspects of care, but spirituality is an extra and very important area which can aid the diagnostic process as well as being able to work out how to help patients. Junior doctors may themselves have negative attitudes towards religious faith or spirituality, and this may make them feel embarrassed or uncomfortable when talking to patients about these issues. Having regular teaching for junior doctors on spirituality will help allay these fears and actually make them better clinicians when treating patients.